I'm just looking for my mask.
Dozens of nurses and medical professionals staged a protest outside the hospital this morning. They say management is limiting access to critical personal protective equipment, PPEs, and asking nurses to reuse N95 masks for an entire week. The nurses say that puts the staff and their patients' health in danger.
We know our job and what we need to do, and we just need the tools to do it safely. We know that the federal government has the capabilities to give us the supplies and the ventilators, the PPE, the IV pumps, all of the stuff that we are lacking now. There are ways for us to get that, and we need them now. We needed them.
None of the nurses are wearing masks, not even surgical masks, in the hallways when they're giving report to each other. I had my own N95 mask. I told my manager, I understand we're short on supplies, but let me protect myself. Let me feel safe. I have family that I have to come home to, and the way things are looking, this isn't gonna get any better. America is not prepared, and nurses are not being protected.
They've been delivering for years 10 to 20,000 masks. Okay, it's a New York hospital, it's packed all the time. How do you go from 10 to 20 to 300,000? 10 to 20,000 masks to 300,000, even though this is different. Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? I want the people in New York to check, Governor Cuomo, Mayor de Blasio, that when a hospital that's getting 10,000 masks goes to 300,000 masks during the same period, people should check that because there's something going on. Well, it's not, I don't think it's hoarding. I think it's maybe worse than hoarding, but check it out. Check it out.
In one area hospital, medical providers say they're being asked to reuse masks that are designed for single use only. Another facility is reserving masks for patients, and staff are being asked to go without in some situations. Multicare Puget Sound says all 6 of their hospitals are facing shortages, and they've implemented reuse policies to stretch supplies until more can arrive. A spokesperson said their policy was implemented with infection prevention specialists and epidemiologists. She said, "We feel like it's the right thing to do to make sure we have some masks because we don't want to get to a point where we have no masks." One nurse there, who asked to remain anonymous, said, "My biggest concern is that too many hospital workers will get sick at the same time. If too many workers are sick, then we literally would not be able to save people."
So today was the first day that I've worked since our unit was designated the second COVID ICU in my hospital. And I don't know what the has happened for the past 13 hours. Honestly, guys, it felt like I was working in a war zone. Completely isolated from my team members, limited resources, limited supplies, limited responses from physicians because they're just as overwhelmed as we are dealing with a ton of other stuff.
The states should have been building their stockpile. We have almost 10,000 in our stockpile, and we've been building it, and we've been supplying it. But the states should be building. We're a backup. We're not an ordering clerk. We're a backup.
Things that this crisis has taught us, sir, is that we are dangerously over-dependent on a global supply chain.
Instead of the more protective N95 respirators. Reaction, as you can imagine, is fierce.
We are on the front line, so as a person, as a human being, I'm concerned for my colleagues and the people that I spend my time with and my days with. I want everybody to be safe.
The move comes as protective gear, including N95 respirators, are in short supply all across the country. The CEO of one hospital group in Georgia says he's never seen a run like this.
What normally takes us 6 months, we've gone through in just 1 week.
Here in San Diego, nurses with UC Health are blowing up social media. One nurse on Facebook posted, quote, "I know that we nurses are scared. I know that this is unethical to put us directly in harm's way." The nurses union agrees.
Nurses are being asked to actually reuse use masks, including surgical masks.
Driving to work yesterday, we saw a lady that was in her car with a mask on, and it was so nice that she could have a mask, but we can't. And I'm sitting here trying just to stay as healthy as possible, and this is what they give us. So this is actual real life in the hospital now. They give you a paper bag, and they give you your N95 mask, and this is signed out for the entire year. This is what I have to go into patients' room with, and then this is what at the end of my 12-hour shift I put into this paper bag and bring home with me, and I have to bring it to and from work every day. Do you think that that sounds safe? Because we are completely out of resources. There are no masks, there are no gowns, we're running low on gloves.
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it, you know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question. Because the shelves were empty. And you know what else? The military shelves were also empty. We had no ammunition, literally. And that was said by one of your favorite generals. We have no ammunition. Guess what? We had very little medical supply.
Is there a plan to make sure doctors and nurses and healthcare professionals finally are able to get the personal protective equipment or PPE that they need? Those healthcare workers are quite literally dying while they try to protect our society and save lives, and they're begging for PPE. They don't need to be told that their governors or their hospital directors are doing anything wrong by trying to get those supplies to protect their lives while they try to save our lives. They need to know that there's a plan to get them the supplies they need. Governors and mayors right now are literally bidding against each other and against the federal government to try to get these supplies. This is escalating the prices and causing confusion and unnecessary bidding competition. Is there a plan to stop that? What is it?
Who can? The mask.